I just want to talk a little bit about domestic violence. I know that your government has done a lot in this space. You have committed to ending violence against women in Queensland. The Women's Justice and Safety Task Force reports have been really excellent and well responded to by government. There's been the Queensland Women and Girls Health Strategy. We've seen the modernising of rape laws. We've seen legislation related to coercive control. So, I don't want to
strangulation. Yep.
So there's a lot's happened in this space. We are continuing to see demand for services that is almost impossible to meet. We know that there has been a 20% increase of funding to our specialist domestic and family violence services, but still 1 in 4 women in Queensland have experienced physical or sexual violence at the hands of a partner. 1 woman is killed by an intimate partner every 10 days. And as I say, our frontline services are stretched well beyond the demand that they're receiving. Is there more that your government would do to support our frontline services?
There has to be. We've got to keep doing more, and it's hard. It's hard to push back on the hopelessness of a policy area where it always feels like the more you do, the more you uncover, and but we have to push back on that hopelessness. We have to aspire to achieve the goals that we've set, and we have to. Again, it's one of those issues where you have to do it all. You have to deal with the acute and the crisis, and the woman who needs to escape a home today. You need to address the kind of complex causes of drug and alcohol addiction, mental health, all of those, and somehow we need to be teaching boys not to perpetuate the cycle. And of course, many of those men have grown up in households where they've watched their mother experience abuse, or they've experienced abuse themselves. We know that. So teaching them something different is not as simple as, boys need to respect women. It's much more complicated, and long term, that's what'll deliver that's what'll achieve the goal. Somehow we have to be doing that, and the prevention, and properly funding crisis and acute services as that demand just seems to keep growing. The more we do, the more it grows. And you can characterise that as a good thing. More women feeling confident to seek help, more services out there. That's all good and true. It's hard to measure the success and benefit of your outcomes when that constant sense of the more we do it feels like it's getting worse. And I feel that frustration that your workers and your services must. I know they do, because I talk with them.
And they do, but I also don't think necessarily that it's hopeless, because our services save lives every day. And as much as we're seeing increasing demand, women that are provided with the service and support can go on to establish their own lives again, and to heal, and for that violence in their lives and the lives of their children to end. Yes. So potentially the numbers are horrific, but investing in our services is not just about meeting the demand, it's about saving lives and helping women and children to heal and recover,
right.
which I know you know that.